Okay, coming back on RockTape, we're going to be talking about Diastasis Recti using RockTape and the support that it brings. So looking with my demo here, we are going to just move the camera down a little bit. All right, so we have the rectus abdominis, and then we have the external obliques. So when we go to check, if you have diastasis recti, that's the split in the linea alba. When you're pregnant, it expands out, and then you have coning. So the way to establish that kind of assessment is with a pelvic floor physical therapist. You can lay down and taking as many fingers in between the linea alba and bringing your legs up. So do a demonstration. Lay down on your back on the floor. So you're gonna lay on your back. You're gonna bring your knees up, and then you'll take as many fingers, placing it in between the linea alba, and then you'll bring your chin to your chest. So you're gonna slightly come up. And as you can see, obviously she hasn't had a baby, so she's not gonna have coning and she's not going to have diastasis recti. But usually you'll see a little bit of coning right in between the linea alba, and then you can feel your fingers going deep within the tissue. And right now, hers is pretty solid. It's cartilage tissue. So you can have diastasis recti as far as the pubic symphysis and as far as the xiphoid process. So I'm gonna show you a demonstration as well as how to tape possibly diastasis recti with protrusion, like an umbilical hernia. So right now we're gonna get back up. So you wanna cut a piece of tape like in a circle to put on the belly button. When you're having an umbilical hernia, you would see a protrusion and the belly button halfway coming out. Dismiss this little trinket right here. So what we would do, obviously if you had an umbilical hernia, most people, they might keep that, and other times it creates tension and could, honestly, it hurts. So we would put the RockTape right there. No stretching, you're just gonna place it there. So it then pushes up the tissue and it allows that tissue inside to go where it should. Then we're gonna take the RockTape here and we'll just go ahead and break a little half piece off at the end. Make sure it's rounded like so, because if it's cut on edges, it will catch on your clothes. So we'll just go ahead and tape that off. And then we wanna place it right underneath where the pubic symphysis starts. And I'll go ahead and have my person do that. Place it right where your pubic symphysis starts. Yep. Is it stuck? Yeah. Okay. And then you want to take the rest and undo it. You don't want to create any kind of stretch, and you want to go all the way up, a little past the xiphoid process. Okay? So you're going to go up just like that. And there you have it. So you can do this while gaining the tissue back. I know taking extra collagen within your diet also helps, and it will give you support while you are doing your daily activities or exercising and that kind of thing. I'll go ahead and show other demonstrations and other kind of taping in some other videos or pictures. Thanks. Okay, now we're looking at a stomach that actually is 3 years postpartum, has bared 3 children, and has had stage 2 diastasis recti with coning. So we have our external obliques over here, and then we have our rectus abdominis, along with our linea alba, which goes all the way down to the pubic symphysis, all the way up to the xiphoid process. Now, when we talk about diastasis recti, we're talking about the linea alba protruding out and splitting, and that's how we have diastasis recti. In our postpartum period, sometimes when we do crunches, you'll see partial coning here, and as you can see here, a little bit of coning is happening, but with RockTape, you can find ways to support and bringing that linea alba to grow back together. So this will be our next demonstration. So we'll take 2 pieces of RockTape, okay? And then we're gonna take little pieces, and I'm gonna show you how to use that. So the way to establish and find if you have diastasis recti, you can have up to 4 fingers in between your rectus abdominis where the linea alba sits. So as you bring your knees up, you'll also bring your chin to your chest, and you'll just find your linea alba, and you're gonna feel the tissue. And then what you could do is, if you could stick 1 finger in, 2 or 3, that's how you can establish how far your linea alba has stretched and what stage of diastasis recti you are in. But for RockTape, we're going to take the RockTape, making sure, again, the edges are rounded. We'll go ahead and bring 1 piece down here, bringing a slight stretch up, about 40 degrees, and then you're just gonna bring that all the way up, maybe underneath your sports bra. You'll take another piece, same thing. Bringing it down. And then bringing a slight stretch up and just bringing it all the way up underneath your sports bra. So then next, mine's a little crooked and not where it should be. It should be a little bit closer to the linea alba. So you want to get it as close as possible, because the next step is you're going to take your, I will call them X's, they're little pieces. You're going to cut them. And what you're going to do is you're just going to place 1 here, and you're just gonna X all the way down. So I'm gonna bring this one over a little bit more. Okay. It's always easier when somebody else tapes you. Taping yourself isn't usually ideal. So you might have more protrusion in one area than the other, but you're gonna take this, you'll place it on the skin, a little bit of a stretch, 1 there, same thing. And then you're just gonna exit all the way down. And if you want, you can take another piece of RockTape and place it over top. But you wanna just make sure that when you're doing this, your tape, my tape is a little bit short, but you wanna make sure that your tape is on top of each other. So you wanna have your tape on this side and on this side, and you just wanna crisscross it all the way down. When you're finished there, if you wanna put another layer on top, you can, but this is another support method for support. It's for support for diastasis recti, for extra support during when you're trying to exercise, or sometimes when we have diastasis recti, we'll have a lot of lower back pain. It's because our core isn't strong enough, and we need to regain that strength and bring everything back together. So this will help with that. Any questions, please comment on my page, or you could go to www.earthboundtherapeutics.com. Thanks.